Alright, so this is section 3, which is the first section that we're going to be talking about, the community health worker history, global, national, and Virginia. This is basically just to share some information with you about the global history of community health workers, where they came from, and how they ended up coming to Virginia and serving such a big purpose. Just reading over the global history, it was traced to early 17th century in Russia. There was a shortage of doctors and encouraged the lay people to actually serve the military personnel. Their big mission was to take primary health care to remote rural areas without doctors. CHWs as natural helpers. The basic lay healthcare system is made up of natural helpers that community members trust. Trust is a big quality that we're looking for within our community health workers, because we know that without trust, a lot of times we would not be able to accomplish much of anything, because people would not be willing to share information with us or even be upfront with us about their medical diagnosis. CHWs in developing countries, they play a pivotal role by providing education, support, and referrals. And even though we're not a developing country, we play that pivotal role as well, because our primary responsibility is going to be providing education, support, and referrals, which is also case management. National history. In the 1950s, there was a beginning of formal participation. There was a rising need because of limited access to advanced care, increasing costs of health care, reduced interpersonal communication between providers and patients. Providers don't always necessarily have all the time in the world to talk to their patients about what needs to be done with the diagnosis, what their medication is, side effects, things of that nature. So the CHWs were employed to bridge the community to the healthcare service delivery system. Just going a little bit back in history, the Great Society in the 1960s, CHWs emerged and as part of programs launched by President Lyndon B. Johnson. His primary mission was to end poverty, promote equality, improve education, rejuvenate cities, and protect the environment. There was a Federal Migrant Health Act of 1962 and an Economic Opportunity Act of 1964, which mandated outreach efforts to low-income neighborhoods and migrant worker camps. Primary responsibility of there was to bridge the gap between people and resources and integrate medical knowledge with local knowledge. Being that they had migrant workers and things like that in the low-income neighborhoods, they may not have had the resources that they had in the areas that were less populated as well as higher income. The Center for Disease Control and Prevention, in 1993, they created the first national database, which was the Combined Health Information Database, which included programs, training centers, journal articles, models, research, and practice information. There was support in numbers. Currently, we have more than 120,000 CHWs serving the communities throughout the U.S. Many states have associations to promote and standardize the role of CHWs. Currently, Virginia does not, but we do have advisory groups and a task force who is working on that, as well as some states have passed legislation that requires the use of CHWs. A little bit of Virginia history with Community Health Worker Network. In 2004, between 2004 and 2008, JMU basically passed the Virginia General Assembly passed the House Joint Resolution with JMU to study CHWs in Virginia. They wanted to see exactly what CHWs' roles were. They wanted to see the potential use as best practice quality measure. They wanted to develop a statewide core curriculum, so whatever the CHWs were teaching or however they were being taught, it was one uniform curriculum. And they also wanted to maximize the value and utilization. But unfortunately, in 2008, that funding was eliminated. However, in 2012, the Virginia Department of Health brought together stakeholders to re-energize the efforts. So out of that became the Virginia CHW Task Force, which is a mix of large and small public and private organizations. Those organizations serve a responsibility to talk about exactly what CHWs need to do, how they need to do it, and where they will be serving. The task force goals were to identify current CHWs initiatives in Virginia. There really weren't many, so this is basically us bringing something new to the state of Virginia. recommend core competencies for CHWs, which are basically the qualities that a CHW needs to embody, identify and or adapt a standard CHW training that can be utilized in Virginia, as well as make initial recommendations on the certification and reimbursement of CHWs. This last one is still a work in progress. With certification, we have not developed a way to make everything legitimized and certified yet, and we have not developed a way to have CHWs reimbursed through Medicaid or insurance for their services. The current structure of the CHW Task Force, we have a Virginia CHW Association, which is led specifically by CHWs. You all are allowed to participate in the webinars and things like that for the CHW Association. They provide a lot of nice information and determine what's going on within CHW networks to connect you to other networks within the city of Virginia in different cities. We have a Virginia CHW Advisor Group, which serves CHWs by raising awareness of efforts, scope of practice, credentialing, reimbursement, and development. And we have a Policy Task Force, who are basically high-level decision makers that serve as a subset of the advisory group to identify policy and legislative issues.